So welcome back. Now today we will be talking about scleroderma. Now scleroderma is from Greek and it means hard skin, and it was first described by the father of Western medicine, Hippocrates, around 400 BC. And he was one of the first physicians to say that disease was not a punishment from the gods, but actually it was from nature itself. And he describes these patients with thickened skin. There are many types of scleroderma, but the types that we are going to talk about today are the systemic types. And this is where the skin is hard on the outside, but there is also some attacking going on the inside. So scleroderma is when the immune system is overactive the wrong way and attacks the skin on the outside and organs and blood vessels and muscles on the inside. It can be called limited scleroderma when less of the skin is attacked on the outside and less of the stuff is attacked on the inside, or it can be called diffuse, where more of the skin is attacked on the outside and more of the things are attacked on the inside. When it comes to symptoms of scleroderma, it really depends on what subtype the patient has. But there are a few symptoms that happen frequently in both. The first is called sclerosis. This is a fancy word for skin thickening. And if you can imagine, if the skin gets thick over, let's say, the joints of the finger, then the patient can't really bend that finger anymore. In the limited scleroderma, this skin thickness happens in the fingers, which is called sclerodactyly, and it happens a lot around the mouth so that they can't open their mouth fully. In diffuse scleroderma, this can happen on any part of the body, including the arms and the legs, and covers a larger area. The second thing that is very common to both types is called Raynaud's. And Raynaud's is when the blood vessel going to the finger or the toes actually becomes abnormally small or more narrow at even a small drop of temperature. So normally when our bodies are outside in the freezing cold, it is normal for the blood to the finger and the toes to be clamped down or to be shut down so that more warm blood comes to the middle of the body where the brain and the heart and the lungs are to kind of keep the important things alive. However, in Raynaud's, this phenomena happens even with a slight temperature change. So even when the patient wraps their fingers around a cold drink, or they reach into the fridge or the freezer, etc. Now, it is important to note that all Raynaud's is not due to scleroderma. In fact, for every 1,000 people on Earth, 4 people have Raynaud's. 3 people, that's how they are made, but 1 person has it due to an autoimmune disease, and not just scleroderma, but other types as well. The third thing that is very common in both these diseases is attacking of the gut or the GI system in these patients. So if the esophagus is affected and these patients can't swallow as well, or they're getting a lot of heartburn, it can be called esophageal dysmotility. They can also get small blood vessels in the lining of the stomach that will constantly leak a little bit of blood into the stomach, and so they can become more anemic over time. And some of these patients can have a hard time moving their bowels, so certain areas bacteria can overgrow in the bowel and cause a lot of bloating. Now, as far as each subtype, so when it comes to the limited scleroderma, what is unique to this subtype is called calcinosis. And this is because the damage that is going on in specific parts in the body, some calcium can build up in the wrong places and it can turn into a crystal. Now, it can also make these little hard knots like in the inside or right underneath the skin. And what happens is sometimes these little bumps can actually go through the skin and kind of erupt. And at that time, what happens is this chalky material comes out and patients will get these sores that just kind of never heal. The other thing that is unique to the limited scleroderma is they can get telangiectasias, meaning that they can get these pinkish red spots on the skin. They're flat, they're not bumpy, but basically you can see abnormal blood vessels through the skin of the patient themselves. The third thing that limited scleroderma patients get more is called pulmonary artery hypertension. And this is basically a fancy word for saying that their heart is working too hard. So the blood pressure is high inside the heart, not in their arm, but inside the heart. And limited scleroderma is also known by an acronym CREST, C-R-E-S-T. And basically CREST stands for C for calcinosis, R for Raynaud's, E for esophageal dysmotility, S for sclerodactyly, and T for telangiectasias. Now, when it comes to the diffuse scleroderma, what's a little bit more unique to them is that they can get the skin thickening all over the body instead of just one place. And they can get some autoimmune lung problems or some lung problems in general, basically because there are certain parts of the lung that can kind of get thickened or can get diseased. They can also get what is called renal crisis. And basically, this is where the blood vessel that's going to the kidney clamps down or becomes very narrow, just kind of like the vasospasm that happens in Raynaud's, but now it's happening on the inside. And when this happens, when the kidney doesn't get any blood, because the kidney is so important to so many different things in the body, it actually becomes a medical emergency where the patient's blood counts will go down, their kidney numbers will go down, etc. Now, who gets scleroderma? So it is actually a very, very rare disease. So if you take the example of how many people do I need in a room for even one person to get it, I would need about 50,000 people in a room for one person to get this disease. It is more common in women, it is more common in Blacks, and it usually affects people in the mid 30s to the mid 60s range. There is a genetic part to this because we do know that there are certain ethnicities that have a very high rate of scleroderma, such as the Choctaw Indians. Now, how is scleroderma diagnosed? Well, it is diagnosed just like everything else in rheumatology, where you take what the patient is saying, you match it up with what is happening on their body. But in this case, the labs and tests are not very good. So it is more of what we call a clinical diagnosis. So for that limited scleroderma, you are looking for that calcinosis, that Raynaud's, that esophageal dysmotility, that sclerodactyly, and those telangiectasias, and maybe a heart problem. For the diffuse scleroderma, we are looking more for the skin thickening all over, some esophageal stuff, the Raynaud's, and then we are also looking maybe for some lung problems or kidney problems if they have it. As far as how is scleroderma treated, well, this is the interesting part. Scleroderma, there is no one thing that will completely push down the immune system and make this disease go away. It's not like one of those autoimmune diseases. In fact, everything is treated as it comes up. And some of these problems need autoimmune medications. Some need other medications like heart medicines or stomach medicines, etc. And some things are just scarred, so they don't really need medication. It's just natural scarring. The one thing about scleroderma patients that has to be taken into account is that we try not to use too high a dose of steroids because it seems the very high doses of steroids, especially in those diffuse scleroderma patients, can cause that renal artery spasm and kind of tip them into renal crisis that then becomes a medical emergency. Now, how do these scleroderma patients do long term? Well, the answer is it depends. It depends on what subtype they have, how much of the disease they have, and where it is. And by far, we do know that what really predicts how well a scleroderma patient will do depends on how much disease they have in their hearts and their lungs. However, it's a little bit tricky sometimes because some of the symptoms are the same in either disease. And this is where it's really important for the doctor to know what subtype they are dealing with. So to give you an example, if I have a limited scleroderma that is very short of breath, I need to look at their heart and maybe have them start heart medications. However, if I have a diffuse scleroderma who is having shortness of breath, then look at the lungs and they may need some autoimmune medication. So this is important so that the patient is treated the right way. As Hippocrates himself would tell his medical students, especially when it came to treating diseases in their patients, to make a habit of two things: to help or at least to do no harm. Until next time.